Hello, everyone. Many of you know my name is Dr. Nina Jefferson, but for those of you that don't know, I am a board certified clinical psychologist and a certified mindset and peak performance coach. And just due to recent events and everything, I wanted to come on and talk about something that many don't, which is suicide and increase awareness. So, The holidays alone is a good reason to kind of talk about this. Many adults, um, have more suicidal thoughts around the holidays due to missing loved ones that are no longer with us, and things like that. And so I just want to talk about it briefly. Statistically, suicide is the 12th leading cause of death in the U.S. It's usually more in middle-aged white men. I think three times more likely, but there has been an increase in Black communities for suicide, and many of us in Black communities still kind of consider mental health as a taboo topic that's not needed. So I want to take a moment to shed a little light on it. Here's some things that just everyday people can look for when you're around your family, your friends, and loved ones, as far as some red flags or some risk factors that not one isolated event, but particularly when you kind of see a combination of these things, to maybe perk up to pay attention to the people around you. So one, like I said, is the holidays, and paying attention to if people have lost someone within that year or just recent, that are really struggling with that. The holidays really trigger things like this. Anniversary dates are another thing that can trigger. So the anniversary date of like a wedding anniversary, or the birthday of a lost loved one, when you can tell the person's really had a difficult time with it. Um, Changes in behavior is a huge one, mainly withdrawal. So this could be as simple as like, call this person for a couple of weeks now, and they're sending me to sorry, I can't talk now. So just not even picking up calls, making excuses to not go out, and even more obvious, just staying in their room, being really isolated and withdrawn. um, Changes in their language, being more pessimistic, kind of more dark at times. um, Outright suicidal statements, not to be looked over and not to be ignored. They're definitely to be taken seriously. If you notice emotional changes with this person, maybe they're more upbeat, um, and you notice they're more down, but just noticing change, period. Um, if you know the person does recreational drugs or is using a lot of alcohol in combination with these other things that impairs judgment, on top of kind of being in this state of mind, can increase the risk factors as well. And just noticing, like, if you're around this person, like lack of sleep, high levels of unmanaged pain, and any mental health diagnosis if you're close enough to that person and it's not really managed very well. So a combination of all those things um, are risk factors to suicide, and just suicidal ideation. It's just something to perk up to. So, we're around people day to day and kind of gloss over things that are odd, and then things happen and we're like, well, I noticed this or that. So I wanted to take a moment to just highlight, here's some things, just you, not a clinician, but just every day. You're around a person every day in the norm and can pick up on things like that. But what to do, right? Like, if you do notice things like this, first of all, do not ignore anyone that has told you they're thinking about killing themselves or have suicidal thoughts. It's definitely not something to be glossed over. You don't have to know what to do about it or do for it, but don't ignore those like that. Every comment is to be taken seriously, even if they've said it 15 other times. You know, there's research on, suicidal ideation. The more frequently they have it, the more attempts. At some point, that's successful outcome, and that's not what we want. So here's some things you can do. One, don't ignore, right? Just be willing to take time and have a listening ear. Truly listen and just take up a space to support someone in their pain, in their time of need. Sometimes people just need to be heard. And you're not a clinician, so you don't have to know what to do with that. But then the next step would be just be willing to offer to take them to a mental health facility, even if it means going with them. That could mean the world to someone that feels like it's too much to deal with. So even just that, but not ignoring is huge. Other things that could be done, like if you're around you notice you can't get a hold of someone, you have some true concerns, is you can actually call the police and do a welfare check, right? You can do that. You can say, hey, I haven't heard from this person in X amount of days. I'm concerned about their well-being and safety, and a welfare check can be done with them. Other things would be, if it's really urgent and you know that, please call 911, right? You don't have to do that alone. Call and get the person help, if it's urgent. And for the less urgent, you can call the crisis hotline. There's a national crisis hotline. It's 988. If you call it, it routes you to your local crisis line number, and ask for some help or get the person on the phone if they're willing to talk. But there are things to do. So it's an uncomfortable thing, right? And many people want to gloss over and act like they don't see that. But we want to kind of take some responsibility to care for our tribe, care for your people, right? And when you see they're in pain, to show up and let them know you're here and you see them. And for my veterans, for crisis line, it's 988 as well. And then you just press 1 and it'll take you to the veteran crisis line. I think those are the main things. If you live with that person or you're really close to them, the last thing you could do is make the environment safer, right? If there's guns in the home, putting them in gun safes or gun locks, and making sure there's no like lethal doses of medications. These would be for people you're really close to, that you could put some control in the environment. Most suicides are done by firearms. So I hope this is helpful. I know this is not a topic that many of us like to talk about, but it's something that I really just felt in my spirit to increase awareness on. And if this was helpful to you and you learned even one thing, please share this video to other people so that we can all take that space to just be a little bit more aware and show up a little bit differently with those that we love and care for. Happy holidays, everyone.